I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. After the pandemic, there'll be a scramble to find a new normal for children dealing with substance abuse, mental health safety, and public health challenges. To talk about these challenges, we've invited Jim Koppel from Strategic Applications International, who has a long and distinguished career in youth work, education, substance abuse, and crime and violence prevention, and Dale Woolery, Iowa's highly respected leader of the Iowa Office of Drug Control Policy. Mr. Koppel has served as the founding president of Community Anti-Drug Coalitions of America and is recognized as a leader worldwide. Gentlemen, welcome to the show.
Thank you.
Glad to be with you.
Jim, tell us a little bit about yourself, your passions, and why you're here today.
Well, I've been working in substance abuse or youth violence prevention for probably 30 years at least, and ran a local coalition in Wichita, Kansas, which received a lot of national attention. It was a control group for the Fighting Back initiative by Robert Wood Johnson Foundation, which put $37 million into substance abuse prevention and treatment. And then I moved to Washington and became the founding president of Community Anti-Drug Coalitions of America. John Bridgeland, who at that time was chief policy advisor for Congressman Rob Portman, now Senator Rob Portman, he and I wrote the Drug-Free Communities Act, and which has now put over $1 billion into communities around the country. Went to the National Crime Prevention Council following CADCA, and also did work with Pacific Institute for Research and Evaluation on research around policy, and I was basically their lobbyist. But in 2004, we started our international work, working first in Swaziland, which is now called Eswatini, working on HIV/AIDS, and then we secured major grants from USAID and from the Coca-Cola Africa Foundation, putting in water wells in 54 different communities, solar water wells. And then went to Kenya to work on a youth unemployment project after the post-election violence in 2007, 2008, where 1,300 people were killed. We were brought in to work on a youth employment project and receive funding from USAID and several other organizations. And we then evolved into a gender-based violence initiative where we discovered 75% of the women in Kenya believed a man had a right to hit them. And so we started focusing on the cultural values around that assumption. And we then evolved and still continue to work on that project, but we're working now on a major police reform initiative with the National Police Service. Police corruption is a big deal in Kenya. During that time, I also worked with President Obama on his coalition or his initiative on police reform, and wrote the major report that President Obama and the task force developed, and then have been working recently with the Council on Criminal Justice reform here. We facilitate, broker, and mediate, bringing different parties with different values and systems together to really come to consensus on how to approach a particular problem. So we've worked in Africa and also quite extensively in the US.
You know, Jim, this is one of the fascinating parts about your career, because when I work with prevention people in the communities, with relatively small organizations with really important tasks right in front of them, this very much conforms with where you started. Yeah. And those the learnings and those teachings become relevant on every scale, from a small community to worldwide. Yeah. And you've taken it to that level, which is fascinating. And Dale, to introduce you, you actually worked with some of Mr. Koppel's programs years ago, familiar with them and CADCA and the funding. Tell us a little bit about how this relates to what's happening in Iowa and how important this mission is. Because Jim, I can't get over it. You really have embellished this holistic view of how people and cultures can heal themselves. And we're trying to do this in Iowa, and I know Dale's been on the leading edge of those efforts. Dale, tell us a little bit about yourself.
Well, I met Jim back when he was pioneering coalition building, and under the definition of coalitions, he's listed, I think, as one of the primary examples because he's so good at it. So got to know him, got to work with him, and we go back a few years in that regard. As for my background, I'll try to leave out some of the more sordid pieces, but I did work as a broadcaster and in media for a while. And but for the last 20 plus years, I've been working in drug policy, drug prevention, drug treatment, and drug enforcement, that arena, and dealing with criminal issues as well. And so, but I have to tell you that, you know, my heart in all of this is really as a parent. I see that as job one. I'm also a grandparent now because I'm of age, 6 times so far, and loving it. But that's where the passion comes from. And I think kind of going full circle, I really believe that family is central to so much of what we do, but we need the support of the communities, and therefore all the coalition building that Jim has worked on and that we've worked on here in Iowa. It's an important supplement and complement to what the family can bring, but they all need to be there and be engaged.
Well, thank you so very much, gentlemen. We're going to take a short break, and when we come back, we're going to continue the conversation about the important issues and challenges our children face today.
I don't know how we would have survived without Mediacom. We have 5 kids, my wife and I, and we have Mediacom for all of our internet and all of our cable services. So I'm stuck in my house, but at the same time, I'm connected to people all over the world, and it's been fantastic.
Thanks to Mediacom, I've had reliable internet to continue to work business as usual, that I can continue to provide for myself and my family.
Right now, we all feel like the world is in a standstill. The internet has played a huge role in allowing us to stay connected to our jobs and the kids schooling online and finding fun and creative ways to stay connected with the ones that we love. We couldn't do it without Mediacom.
Welcome back to Surviving Bad. We're talking about returning to life as we know it and how we need to help our children negotiate some old and new challenges after this crisis that we're facing. Jim, you've had a lot of experience worldwide following some major crises. What do you see as sort of the landscape of things that parents need to be concerned with as not just being in the crisis, but afterwards, when we're going to see this sort of vacuum of services and help that children were used to and needed, and it may not recover so quickly?
Well, I'm a big advocate of an approach on community organizing around developing a theory of change and how organizations operate and function. And our theory of change that we work with is that you begin with the individual, you then go with the broader culture, the organizations that they may be associated or affiliated with, and then either looking at national or statewide initiatives that support. I've probably in the last 2 months have participated in a dozen Zoom calls related to what changes. And I think fundamentally around our theory of change, the individual is coming through this crisis, rethinking their values, reshaping what their future might look like, how their future gets addressed. But ultimately, I don't think the individual changes that much. I think we are humans. We ride through these storms, through these crises. We've been through everything from 9/11 to, Holocaust issues. We worked in Rwanda, following the genocide in Rwanda, and how people came together. But ultimately, the actions and steps that communities took had an impact on the individual, and the individual had an impact on that community. And so I think as we come out of the pandemic, that giving young people a voice in shaping that future, what changes? What changed them? I think we need to hear from them, and we need to set up structures that allow us to hear from them as we rethink our future. And again, I don't think we're going to relapse necessarily back into the bad things. I think the way we communicate, the relationships, the nature of relationships that we have will change to some degree. I have 19 grandchildren and 8 children between us. And I've been watching them as they've been dealing with this issue. And some are doing better than others. But fundamentally, these kids are resilient. They're strong. And I'm confident that whatever the new normal is supposed to be, that they'll navigate it.
That's pretty fascinating. Dale, you have that hands-on experience in Iowa and work with a lot of local coalitions. There's been some talk about the fact that mental health and the care for things that children needed or got in contact with schools have sort of separated from reality. I mean, there's been a little bit of dissonance there where they're not getting it and they're now secluded in isolation. Do you see in your office work at looking at public policy that might help address some of these things after, we get back, when our legislature gets back and we get back to normal?
Well, I think there are a lot of unknowns, and one of them is what types of supports will be in place, because there are concerns about budgets at a public level, and I think that's going to be true probably at the private level and at the family level. That's true today. I guess one thing I'm curious about, and I'd be curious if Jim has any insights in this, he outnumbers me on the grandparenting by, I think, a factor of 3. So I'm counting that as wisdom, Jim.
Okay,
but I'm curious with the family situations right now, as it relates to substance use and just behavior in general. There's an opportunity for a lot more bonding, but it's also an opportunity for some breaking. And I'm curious, maybe you alluded to this, that some may bond and some may break, but I'm thinking it's a positive thing as it relates to future choices, future behaviors, and things like substance use? Or do you see it being a bigger challenge down the road?
Well, I think it's going to be a bigger challenge from the standpoint of resources and what decisions that communities and states and the federal government have to make about what they can support. But the mental health, substance abuse issues, the psychosocial development of children is going to be extremely important. And I think we were making progress there, but I worry that those programs will be threatened. I was involved with this Council on Criminal Justice and Reform. In fact, an Iowan we worked with was Janelle Melhone, who I think you may know, who works in family youth services in the state. And one of the things that we had to look at in criminal justice reform is there's this effort, and it's a good effort, to get people out of prison and to rethink the way we approach juvenile incarceration. And what are the resources that are going to be required to support those young people or people that we release under the First Step Act or other those kinds of policy programs, that it's going to require us rethinking how we do that. But I do believe we will recover economically in a way that will support those programs, where we will see an increase in violence, we will see an increase in crime, we will see major issues begin to surface that threaten the security of communities and the security of families. Because whether it's the substance abusing behavior that comes into a family or the mental health stress that contributes to domestic violence or child abuse, any of those things, communities are going to have to respond to that. Like you, Dale, I don't know what it looks like yet. I'm not too sure. I'm an optimist because I believe in the resiliency of the American people. And I have seen over and over again them respond in a way. But, in the United States, I've always said this, and you may have heard me say this, it's never about resources, it's about will. And we usually find our way to support what we need to do. And that's where I remain optimistic.
Thank you very much. We'll take a short break again. And we come back, we're going to continue to take a look at how we see the world changing and maybe take a look at what that will means to people especially parents and families today. See you after the break. You don't want to miss this.
Today, more than ever, you need fast, reliable internet. At Mediacom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Welcome back to Surviving Bad. The pandemic's changed our minds, and it may be a life-changing historical event for many of our children. But our guests have some wisdom they've gained over the years, and they're sharing some of their ideas with us, and let's continue the conversation. Jim, when it starts drilling down to family and community level, what are some of the things you see as important? Because I know parents are going to be watching this, and they're going to want to connect the dots between what we're talking about statewide and globally to what happens in my home.
Peter, I think for years, based on research done by the National Longitudinal Youth Survey and work done out of the University of Minnesota, I've always talked about 5 resiliencies. And I think these resiliencies are still functional, if you will, within a post-pandemic world. And that is, a child succeeds or is less likely to use drugs, alcohol, teenage pregnancy, etc., if they have hope, something that pulls them into the future. And you can put the word faith there if you want, that there's a purpose to their life. When they get up in the morning, they're driven by that purpose or that hope. The second thing is that it's acquired skills, that they have something that they can celebrate and that they can recognize. I mean, I was in a Zoom call with my oldest grandson this last week, and he's a budding historian because my doctorate's in history. I'm excited, but he spent a half hour walking through political change in the Roman Empire. And I was just thrilled to see his skills development and him be able to celebrate it. And he's an at-risk kid at a variety of levels. He's on the autistic spectrum, et cetera, et cetera. So anyway, skills is important. The third is significant adults in somebody's life. We have got to be sure coming out of the pandemic that adults are connecting with kids on a personal level and that there are significant adults that these kids can lean into and be guided by. That's why mentoring continues to be one of the better and more successful programs. The other is a locus of control. That is where they have a voice in what's going to happen. I think it would be extremely frustrating if we come out of this and we're doing things to kids or for kids. We must do it with them. We must participate in this conversation with them. And the last thing is giving kids an opportunity to give things back. I mean, I cry at movies. And so every night on the news, when I see a story of a young person doing some volunteer act or giving something back in the midst of this pandemic, that's drilling down to a root of who we are as people, based on their faith, based upon their relationships, et cetera. But if we do those 5 things, I think we're going to be okay. And it's the things we've been doing or been trying to do around developing programs, but I think it's going to be extremely important we continue to do them.
And Dale, do you have any input on that topic?
I like what Jim said, and I agree. I too am an optimist, and I think engagement. I think that's going to be critical. It always is, but I think especially now, and I think it's going to take leadership to lead that and remind people that just because you've been hunkered down together in many cases over a period of time during the pandemic, that you can't just now let everything go and assume that everybody knows right from wrong, and that everybody's going to choose, the right path or the healthy path. So I think leadership, guidance, and engagement by family members and many others.
Those are some great points, and we're going to return after a short break where we'll invite our guests to share some final comments, some good advice. See you after the break. You don't want to miss this.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Welcome back to Surviving Bad. We're talking about the importance of a safety net to help our children cope with substance abuse, mental health, and safety. But we also know that children and young adults can think for themselves. And it's not just us giving them things or talking about things. So we've asked Jim and Dale to talk to you. You, the college students, you, the young adults. This next segment is for you. Jim?
Well, to me, because I'm not exactly sure how this is all going to shake out at the end of the pandemic and when we start opening up more, but I always ask young people whenever have an opportunity to be in conversation or dialogue with them, what is it you can do? Given where you live, what you do, your work skills, your background, etc., what is it that you can contribute? I want to hear them articulate that word. And the other is that based on my own journey and my own experience, coming out of a home that was alcohol influenced significantly, and going in and out of poverty because of that relationship, I had to make decisions. And ultimately, we're all making decisions. And I want to hear young people talk about decision making and what influences them in their decisions. And so, as opposed to giving advice, I'm actually wanting to ask questions and to hear from them as to what they believe will pull them into the future. And when I do that, I get amazing answers. And it falls back to, well, what they want to be, what they want to do, or who influenced them, who shaped them. I'm doing this initiative called the Legacy Project, and where we're talking about not so much what the things we leave behind in terms of cars, houses, boats, etc., but what is the core values that we inherited from someone else that I want to articulate. And so with young people, I'm talking about what is the legacy you want to create coming out of this experience. When it's all over, when it's all said and done, what is the legacy you want to leave behind? And those dialogues have been rich in our Legacy Project.
You know, you make a great point, because quite honestly, I don't know that enough adults are asking those questions of their children and actually listening to them. Dale, your thoughts?
I'm going to pick up on something Jim said before. I think it's a great opportunity for young Americans to pay forward and take a cue from the medical professionals during this pandemic. They're paying it forward. They're giving more than most people are ever asked to give, and they're paying it forward to help others. Well, our teenagers, our preteens, young Americans can do the same thing. Positive peer pressure, lead by example, brothers, sisters, friends, and we see examples of that. I think creativity is everywhere right now because it's forced. People are forced to get creative, find solutions. And so I think it's a wonderful time actually to lay the groundwork if you're a young person and become a leader now and in the future, and lead us, whether we're asking you questions or if you are providing us answers. You can lead us and your peers into the future.
Thank you, Dale. Jim, one question for you. I get to work with a lot of children too in the schools. And one thing I often hear is that, I try to talk to them and they don't listen. And I get very passionate saying you need to be assertive. You need to work at it and keep trying, because sometimes parents and adults don't listen well. And it's not a crime to work really hard at trying to get them to listen. On that note, do you have any advice you can give kids?
Yeah, I think active listening is a skill that needs to be developed by teachers, by parents, by grandparents, by all sectors of the community. We're all too eager to provide quick solutions. And I talk about complex adaptive systems where a child, and coming out of the pandemic, I fear this is what's going to happen. We're going to work on their education issues in this silo. We're going to go over here and work on their health issues in this silo. And we're going to work on their employment issues in this silo. That child does not live in silos. That child lives in a complex system of relationships. And I think parents need to recognize, and teachers need to recognize, that this is a complex child and with many influences. And the more we can inform them about that and do active listening, because there's nothing more frustrating in a relationship or a conversation with a child or a young person when they just simply don't want to talk. But I have questions that I continue to pursue that get them talking about themselves. And that to me is the healthiest thing we can do.
What a great note on which to end this discussion today. Thank you, Jim. Thank you, Dale. And thank you all for joining us today. If you go to our website at ahealthyiowa.org and register for updates, you can get news of our upcoming shows and more information. Keep your eye on Mediacom MC22 for our next episode of Surviving Bad, where we explore Iowa's stories of survival, hope, and inspiration on Mediacom MC22, your local programming leader.